Thanks so much, Chris. Okay, now it is the audience's time to ask us questions. So I'll if you haven't done so already, if you're on Genome TV, please put your questions in the chat feature. If you're watching on Facebook Live, please put it in the comment section. The questions are already coming through. We can see them. So I'm just going to hop right into it. We've got about, I would say about 10 to 15 minutes left to answer some questions. The questions are coming in for Tada. Alicia Santiago, hello, Alicia, said to Tada, very cool project. Are there any genetically pure bisons left?
Hi, Alicia. Yes, I really enjoyed this project because it's so culturally significant to our people. And currently, the Yellowstone population and then also Wind Cave are considered genetically pure. And it's really cool because Wind Cave is culturally significant to the Lakota people's creation story. So they're really close to the Pine Ridge Reservation and probably about 45 minutes away from Rapid City. But we need to encourage projects like this because then tribes and other herds can figure out, what is the status of their population and the integrities of their herds.
Tada, another question for you from Alicia. Tada, maybe I missed it, but have you introduced your project to younger audiences, middle or high school students? I think they would find it fascinating.
Hi, Alicia again. I haven't presented my project to middle school or high school students in like a conference type setting. I've had my poster up and they can come and take a look. The main places I've been presenting were to herd managers, other tribal communities, and then academic conferences.
Any other questions? I see one here. Belen, maybe you want to answer this or we can do this one together. How do you ensure the information provided in the short course is accurate since it's so cutting edge, not in the textbooks yet?
Well, thank you for your question. We really work with top-notch professionals that are in the forefront of genomics. Our faculty are encouraged every year to revisit the content of the lectures and update it, and both following the trends in the research, but also the feedback of the teachers and what they find more interesting. So I would say that as accurate as it can be, as you find it in scientific journals, in PubMed, the information is at that level because it's the people who are collecting the information that are teaching the course. And then, of course, we'll have the input of the educators who are the experts in transforming the scientific knowledge into something that is translatable to a classroom. That piece, we really trust our educators. They know what their communities need. They know how they learn. And they are the ones that are the experts in that part of the process.
Thanks, Belen. All right, we've got some more. All right, how can students break into becoming genomics community educators and get involved in programs such as the one at the National Museum of African American History and Culture? This one, I think maybe we'll start with you, Chris, and then we can add some stuff in.
So if you were interested in participating in the program at the National Museum of African American History and Culture, what you would need to do is to visit our webpage at nmaahc.si.edu and then go to our events page and look for upcoming events that we may have. Well, currently, right now, Smithsonian Institution museums are closed, so there aren't any programs that are listed currently. But if you go back and check back every couple of weeks, I'm sure eventually you will see the one for the program that we have planned for this fall. And once you do, you should be able to either register or possibly get tickets so that you'll be able to enter the museum to participate in these programs.
Okay. We have a question, Belen, from someone who is, I believe, coming this year to the course or thinking about participating virtually. It's from Marie. Thank you so much for your hard work on this, everyone. How will this year's short course be different from previous ones since it will be virtual? I can start, Belen, and then you can fill in. So, Marie, and to any of the folks who are watching, who are part of the 2020 short course, who are thinking about whether they're going to participate virtually or have decided they're going to participate virtually, we have never done a virtual short course before, but these are different times. And Belen and I are definitely up for this challenge. And so are the faculty who are teaching the course. I will say, Francis Collins, Dr. Francis Collins, the head of the National Institutes of Health, published a crazy statistic that between like 3 weeks, NHGRI, or I should say the NIH, had been on 150,000 Zoom calls or some kind of virtual meeting of some sort. So we're getting quite good at this back and forth with the virtual. It will not be a straight lecture the way that we usually do. Like a large portion of it will be lecture after lecture. Then we'll do some breakout sessions. Then we'll do a tour. Obviously, we're trying to figure out whether we can do a tour virtually. We're thinking about whether we can do some labs ahead of time, so then we can meet. There will be much more, and maybe we'll incorporate this for future years, but we've got to build the community before everyone sees each other on the screen. So we're going to have some meetings along the way so that we can start building that community before we get there. But the content, we think we can deliver much of the content that we've delivered in years past. But obviously, we want to build that community. One of the great things about the short course is that community that gets formed. So.
Yes, and I would like to add that typically, the participants come to short course without knowing each other, and then they form those relationships and continue those relationships after they leave. This year, we're going to reverse that paradigm. We're going to try to make you know each other and meet each other and share some of your work and your needs with each other before the course. So by the time you get to short course, there's already some kind of a network that is been working, and you also are going to be our advisors. By July, you're going to be experts in how to address the needs of your communities virtually. So your input is going to be very valuable to actually design the course and make it the most useful for you. So you are going to be our partners from now to the course. Then we'll have the course, and then we'll evaluate how things went. And we're very excited about this new format. I promise it's going to be good.
Yes. All right. This question is for Tada from Adrian Quijada. And I should say that hello, Adrian. Adrian Quijada is one of the co-founders of the Tribal College Consortium, one of the 2016 short course alumni that started the Tribal College Consortium in partnership with us. So his question is for you, Tada. How do you think genomic education may impact virus research perception in Indigenous communities?
I think that if tribal communities had more access to genomic education, then they could make educated decisions while also maintaining their cultural sovereignty in regards to not just necessarily virus research, but any type of genomic research. And also by bringing in more genomic education into the communities, you allow the tribal community members access to that information where they can guide their neighbors, their family members, their relatives on the best way to be a part of any type of genomic or virus study.
Thanks, Tada. Chris, how can we best work with local cultural museums to help them understand the importance of genomics and ancestry to health and social determinants of health?
So if you're going to think about working with a local organization, a local museum, it's definitely important that you and the staff at the museum are just aware of that. Everything that we are is because of our genetics, our genomics, and then you layer culture on top of that. And then that's how you get the world that we have today. And so if you're going to try to create content based on genetics or genomics, it needs to have some relationship to some of the exhibitions or topics that are featured at the museum, because museums, as much as the people at the museums, as much as they are likely interested in helping and working with different organizations and different groups, it still needs to be something that falls in line with the mission of their museum. So I think it would be best to identify a person within the museum who you can talk to and reach out to get more information about the mission and focus of the museum, and then see if your idea has any relationship or any possible connection to what they're working on, because you never know what you'll be able to create or what connections you'll be able to create if you just reach out and chat with someone.
Thanks, Chris. So we have a question from Greta, and I think this might be a Greta that I know, but she said, to all the work you're doing is awesome, and thank you. Thanks, Greta. What recommendations, she has two questions. What recommendations would you have for introducing the genomic short course to other colleges and universities? And then Tada, she'd like to know, is the Tribal College Consortium on genomics training an ongoing entity? So Belen, do you want to take the first part of that, and then Tada will ask you to answer the second part? Belen, I think
we have, like, up to now, short course has always been local to us and centered in the headquarters of the NIH here in Bethesda, Maryland. Over the years, we have discussed many times, how can we scale up the course? How can we replicate this course in other communities that perhaps don't have the means to travel to us, and just basically to reach more educators as well, because we reach at the most 25 educators per summer. I think this virtual experience this year is going to be really important for us to explore how to clone this course in other places and get creative and reach more communities. So I really want to emphasize that if you are a short course participant for 2020, you are going to be a partner from the get-go. You're going to help us design and think together, how can we expand the course and make it reach other communities in other non-traditional ways. So this is not going to be you sitting in front of a computer and just going through lectures. We're going to partner together like we always do, and we're going to create a new model that hopefully will reach other communities.
And Tada, is the consortium still going?
Hi, Greta. Okay, to my knowledge, the consortium is an ongoing entity. Although I directly benefited from the creation of this consortium, I'm one of the most recent members or participants. So I think Christina might have more information regarding that.
Sure, I can answer that question. So the consortium is ongoing, and it's about to have sort of a resurgence, I would say, for lack of a better term. And there are faculty who have taken this on, and I expect to see in 2020 and 2021 a lot of things that come out of the consortium. So stay tuned, Greta, and keep in touch with us. So I think that is our last question that we can take. So I just wanted to thank everyone on the panel. Thank you, Tada. Thank you, Chris. Thank you, Belen. Thank you to the NHGRI communications team. Thank you to our short course alumni, our new short course attendees for this year and next year, and also the NIH faculty who teach the course. And last but not least, thank you from Belen and me to the Education and Community Involvement Branch at the National Human Genome Research Institute. It's a group of fabulous rock star ladies that we work with every day that let us put on a great short course and work with the museum and work with students like Tada and the Tribal College Consortium. So thank you to everyone. If you have a question that comes into mind that you weren't able to ask today, please feel free to email nhgri_communications@nih.gov, and feel free to reach out to any of us. Thanks so much, everyone. Enjoy the rest of your afternoon.